Would you be able to know if you were having a heart attack? Do you know what the symptoms are? You may be surprised to hear what some of the symptoms are, especially in women. Here to help us with this very important health issue is Dr. Suzanne Steinbaum, a cardiologist who specializes in women's heart disease at Lenox Hill Hospital in New York. Hi, Dr. Steinbaum.
Hi.
Dr. Steinbaum, are there distinct recognizable symptoms of the onset of a heart attack?
In women, it gets a little more challenging to diagnose. In fact, you might not see the typical squeezing chest pain that you see in men. In fact, women sometimes present with shortness of breath, jaw pain, back pain, tingling, flu-like symptoms. It's very, very different. They might just have nausea. It's very difficult and challenging to diagnose heart disease in women.
We always think of pain radiating down your left side as the real indicator that you're having a heart attack. Is that always the case?
Women can present in so many different ways. In fact, recently I've had a patient who presented with having neck pain, and this pain was radiating down her right arm. She experienced the pain when walking, and it went away when she rested. She had an MRI of her neck, and she was actually diagnosed with having spinal stenosis, a little bulging actually of one of the discs, and they felt that the symptoms were due to this. Well, we looked at her risk factors. She had high cholesterol, a family history, and high blood pressure, and we did a stress test, and it was extremely abnormal. She ended up having a coronary angiogram looking at the insides of the arteries, and she had a 99% blockage of the top part of the heart in one of the major arteries. So it's very important. Pay attention to your risk and pay attention to your symptoms. And know that if these symptoms are happening with exertion and relieved with rest, this is the most important thing to understand. And then look at your risk factors. And if you have them, it's very important you get evaluated for your heart.
Dr. Steinbaum, what if you're with someone who seems to be exhibiting more than one of these symptoms at a time? What should we do if a friend is with us?
I think what we need to understand, first of all, is each woman has a risk. Are they in fact at risk of heart disease? It doesn't come out of nowhere. It's not like you're on the treadmill and you're getting short of breath, oh, clearly this is a heart attack. But if you have risk factors such as high blood pressure, high cholesterol, you smoke, you have a family history, diabetes, you're not really an exerciser and maybe a little overweight, these risk factors are what's associated with heart disease. So take these into consideration when you're looking at your friend. And if in fact, if you see your friend having chest pain, shortness of breath, or exhibiting these symptoms, aspirin, chewing 2 aspirins are very important. It helps prevent the platelets from clotting and sticking together and a heart attack from developing, and call 911.
Chewing aspirin, not swallowing.
It's better to chew it. In the emergency situation, it gets absorbed much quicker, and it actually can prevent a full-blown heart attack.
So trust yourself. If you think you're having a heart attack, it's likely that you're having a heart attack.
I think we know. I think if you pay attention, we know. And if you think it's happening, better be safe than sorry.
Absolutely. Thank you so much, Doctor.
Sure.
For Howdini, I'm Lisa Birnbach.